Hello, I'm Dr. Stephen Fein. I'm the founder and president of Hem-Onc Call, a telemedicine hem-onc practice dedicated to treating patients with ITP. Here are some important disclosures for the video. With DOPTELET, starting at 1 dosage strength makes titration manageable. The recommended starting dose of DOPTELET is 20 milligrams once daily with food. Titration up or down should be done as necessary based on platelet count and patient goals. Platelet count should be assessed weekly until a stable platelet count of 50 or higher has been achieved, and then platelet count should be maintained monthly thereafter. The recommended starting dose of DOPTELET is 20 milligrams once daily with food. In patients with chronic ITP receiving concomitant medications, the recommended starting doses are as follows. For those with moderate to strong dual inhibitors of CYP2C9 and CYP3A4, initiate DOPTELET 20 milligrams, that's 1 tablet, 3 times a week. For those with moderate to strong dual inducers of CYP2C9 and CYP3A4, initiate DOPTELET 2 tablets of 20 milligrams once daily. The single 20 milligram pill offers the flexibility to titrate all the way up to 40 milligrams once daily and all the way down to 20 milligrams 1 time per week. There are multiple dosage increments in between, which are all achieved with the 20 milligram pill.
Indication: DOPTELET, avatrombopag, is indicated for the treatment of thrombocytopenia in adult patients with chronic immune thrombocytopenia who have had an insufficient response to a previous treatment. Important safety information, warnings and precautions. DOPTELET is a thrombopoietin TPO receptor agonist, and TPO receptor agonists have been associated with thrombotic and thromboembolic complications in patients with chronic immune thrombocytopenia. Thromboembolic events, arterial and venous, have been reported in patients with chronic immune thrombocytopenia treated with TPO receptor agonists. In clinical trials, 7%, 9 out of 128, of patients with chronic immune thrombocytopenia treated with DOPTELET developed a thromboembolic event. Consider the potential increased thrombotic risk when administering DOPTELET to patients with known risk factors for thromboembolism, including genetic prothrombotic conditions, factor V Leiden, prothrombin 20210A, antithrombin deficiency, or protein C or S deficiency. DOPTELET should not be administered to patients with chronic immune thrombocytopenia in an attempt to normalize platelet counts. Follow the dosing guidelines to achieve target platelet counts. Contraindications: none. Drug interactions. Dose adjustments are recommended for patients with chronic immune thrombocytopenia taking moderate or strong dual CYP2C9 and CYP3A4 inducers or inhibitors. Adverse reactions. The most common adverse reactions, greater than or equal to 10%, were headache, fatigue, contusion, epistaxis, upper respiratory tract infection, arthralgia, gingival bleeding, petechia, and nasopharyngitis. Please see full prescribing information for DOPTELET, avatrombopag, at doptelet.com.